Hi, everyone. Thanks for joining us today. We'll be starting very shortly. We're just going to give people a few more minutes to jump on. Hang in there. Back in just a moment. Good afternoon, everyone. My name is David Block, physical therapist and regional director at Spear Physical and Occupational Therapy. I'd like to welcome back those of you who have attended one of our other webinars, as well as welcome those who are joining us for the first time. We are excited to be back with all of you today, and we appreciate you taking time out of your busy days to learn with us. For those of you who do not know who we are, Spear is a private outpatient practice that has been around for over 20 years, with currently 20 locations located all over the New York City area. We have successfully continued to offer in-person care through the COVID-19 pandemic, as well as have launched Spear Live for those who are looking to stay in and receive care using our telehealth platform from the comfort of your own home. In our clinics, we are strategically going above and beyond the CDC guidelines to ensure the safety and well-being of everyone. You can find more detailed information on these safety measures by visiting our website, www.spearcenter.com. We are here for you in whichever way makes you feel most comfortable. If you're looking for individualized care, either in the clinic or through telehealth, please reach out to us at your convenience and we'll get you set up for an appointment right away. As physical therapists, we consistently receive questions on what is the proper technique and when should I use a foam roller? We're excited to be able to offer advice and education on this topic today and really look forward to answering your questions and demonstrating some exercises. As part of our session today, we'll be talking through and demonstrating some exercises, and we welcome you to follow along and practice with us as you feel comfortable. Please note that if you're experiencing any pain while performing any of these exercises, definitely stop and reach out to us directly so that we can help you. We created today's talk specifically for you and are coming to you live from our own homes. We don't anticipate any technical issues today, but please be patient with us should any arise as we navigate working through this technology. So some housekeeping stuff, and I know those of you that have been on previous webinars have heard this spiel from me before. I mentioned throughout the webinar, we want to hear from you. If you have any questions, please feel free to let us know your thoughts in the Q&A feature. To find where that is, please take a moment to hover your mouse at the bottom of your screen. You'll see a Q&A option pop up. That is where you'll put questions, and we'll do our best to address as many of them as we can during the webinar. It's best practice to put your questions in the Q&A. There is a chat feature. However, if you put your questions in the chat feature, I'm likely not going to see them or be able to get to them. So please, again, put all of your questions that you have in the Q&A feature. For those of you watching through YouTube Live, we're monitoring the comments section there as well, so please feel free to type your questions in the comment section on YouTube Live only. If you're on Zoom, remember, utilize the Q&A feature. Lastly, there's going to be times where multiple panels are on the screen at the same time. For your best viewing experience, please select Gallery View at the top right corner of your Zoom screen. This will enable you to see multiple panelists at one time. So let's talk more about our goals for the day and what we're going to be covering. So The first major goal is we want to teach you the importance of incorporating a foam roller into your home exercise program. You're going to learn how to relax your tight muscles correctly using a foam roller. And lastly, we'll teach you some mobility and strengthening exercises that you can perform with a foam roller. Before we get started, I'd like to introduce our team of panelists. We're going to welcome everyone on the screen now. So, as I mentioned, at the moment, you should be able to see all of our panelists. If you can only see me, please go to that top right-hand corner of your screen and select Gallery View. It will create the best viewing experience for you throughout the webinar. So, first up, we have Victor Guevara. He's from our Chelsea location. He's a physical therapist. Victor, say a quick hello.
How's it going, everyone?
Next, right below him on my Zoom screen, I have Zach Shampain. He's a physical therapist from our Chelsea location as well. Zach, quick shout out to the group.
Hey, everyone. Thanks for joining today. Looking forward.
And nice. Thanks, Zach. Sorry for jumping in too soon there. I can talk a lot, as you guys all know by now. We have Michelle Rooney up. She's the clinical director of our Chelsea location, and she's going to be helping facilitate on the back end with some Q&A and in the chat.
Hi, everyone.
All right, everyone. That's enough from me. Michelle, Victor, and I are going to say goodbye. Zach, let's kick off this awesome foam rolling webinar.
Hello, guys. So let's start with a quick poll. What can a foam roller be used for? Stretching, strengthening, mobility, getting rid of muscular tension, or all of the above? So think back to the times that you used a foam roller, whether it is at home, at your friend's house, or in the clinic, and think about what you have used it for, whether it's stretching, strengthening, mobility, getting rid of muscular tension, or all of the above. Take a second to answer, and then we'll get right to it. All right, looks good. A foam roller is a simple, affordable home exercise tool that can be incorporated into all of your home workouts. We'll be getting into the exercises in a few, but to begin with, let's talk about the foam roller itself. You can purchase a foam roller online from any major retailer for about $10 to $30. They vary in size and shape. As you can see in the pictures, some come with ridges and points, which can intensify the therapeutic effect on your muscles. Most of the exercises we'll be discussing today would be better performed on a generic foam roller as pictured on the bottom of the slide or with me here today. To elaborate on the poll further, thank you all for answering. A foam roller can be used for more than just relieving tension in those pesky knots throughout your lower extremities, upper extremities, and back. Personally, my favorite use of a foam roller is for mobilization of your joints. In various positions, whether it's sitting, lying on the floor, or kneeling, or using a wall, you can use a foam roller to facilitate your joint movements. Following mobilization exercises, it is always important to restore neuromuscular control within the newfound range. Neuromuscular control is just a fancy term us physical therapists like to use for strengthening exercises, something else a foam roller can help with. Today, we will cover all aspects of the home workout with a foam roller, relieving tension within the muscle, mobility exercises, and strengthening. Before we get to the strengthening exercises, which could be new for some of you, it is important to get the body loosened up, relaxed, and mobile. Let's get started with relieving tension within those tight muscles, which physical therapists like to call soft tissue mobilization. During a treatment session with a PT, a physical therapist, an important skill the PT uses on the patient is soft tissue mobilization. With a foam roller at home, you can address some of the soft tissue muscular tension on your own with some tips from us during this webinar. To begin with, when teaching a patient foam rolling in the clinic, I like to assess their form to see if they've done it prior. Usually patients have done it prior and want to see if they're doing it right. For the most part, the patient will roll back and forth on the area where they have the most tension. This is not the most effective way to foam roll. It is best to find an area of tension and hold that pressure for 30 seconds to 1 minute, and then roll to the next spot. I will now be welcoming Victor onto the screen as he performs some of the soft tissue mobilizations. Welcome, Victor.
Thank you.
So let's first address a commonly tight area, the IT band. The IT band is a thick band of fascia or tissue that begins at the pelvis, runs down the lateral or outside part of the thigh, and crosses the knee. It is not a muscle, but it helps keep your hips and knees stable, particularly during running and jumping. Think of the IT band like a well-tensioned bridge that links the pelvis and the knee. That bridge also applies pressure to the structures, including muscles attached to and underneath. This is a common occurrence after prolonged sitting and then prolonged running, something that we all can relate to. You can easily loosen up that tissue by lying on your side, just like Victor is doing, and placing a foam roller between your legs and the floor as such. Notice how Victor is placing his opposite leg in front to stabilize his body. And then he holds the pressure at one area for about 4 seconds and then moves to the next area. Victor, show how you would do it if, like, back and forth, how you're not supposed to do it.
Yeah, definitely, Zach. So typically we'll see this kind of rolling back and forth. So we definitely kind of, as Zach mentioned,
Not
hold it.
as effective as finding a spot, holding it for around 40 seconds or 30 to a minute, and then moving on to the next spot. You usually notice that there's more tension by the hips or by the knees where the band attaches. Let's move on to the quads. The quads are the 4 strong muscles on the anterior, the front portion of your legs that help straighten your knee. Quad strength is so important to knee rehab and stability. However, you cannot get the most out of them if they're tight and feel tense. And they're always painful during knee rehab. Look, notice how Victor is now, again, applying pressure at each point and then moving on to the next.
Zach, how does my form look?
Looks pretty good. Something that you can do, since he's applying, his elbows are on the ground, you can place like a pillow or something comfortable. The pain is not supposed to be felt in your elbow or anywhere else. It's supposed to be just specifically address the quads. So you're looking good, but if your elbows are to hurt, you want to put a pillow underneath there.
Yeah, that's good advice.
Let's discuss the calves. We have 3 muscles in the calf. 2 are the gastroc and 1 is the soleus. The gastroc is a more superficial muscle which often tightens after walking for a long time on being on your feet. So, an important modification to add when relieving tension in your calves is the ability to perform an active release technique. You can actually perform this technique at the different structures I talked about, but for the calf, it's very simple. While applying pressure to this area, you can move your ankle in all directions, but mostly up and down. And that is applying active motion of the muscle while also pressuring in. This is called an active release. He is using the ankle plantar flexion motion, the heel raise motion. So as he points down, that's how you would do if you were on the ground, a heel raise, to create an active release of the calves. Thank you, Victor. That one looks really good. How does it feel?
Feels great.
There you go. All right. Now, let's hand things over to Victor to begin talking about some mobility exercises. See you guys in a bit.
Yeah, thank you, Zach. So as Zach mentioned, we're going to kind of move into the mobility aspect of everything. So really quickly, I want to pull up a second poll just to kind of get your feedback. So second question, how long should we apply and maintain constant pressure to a spot of tension? All right, so just kind of covering over everything we just touched on. So answers, 0 to 30 seconds, 30 seconds to a minute, or should we be rolling back and forth? All right, so I don't want to give away the answer just yet. We'll kind of give it a few seconds, think about it, kind of things that we covered here. Anything that feels all right. Looks like a good amount of everyone got it correct. So 30 seconds to a minute is typically how long we just want to hold that constant pressure. All right. So now moving forward, we're going to look a little more into the joint mobility aspect of using a foam roller to help increase our flexibility. So Zach covered a lot of lower body activities, and I want to focus a little more on the upper body. It's important to maintain good joint mobility in order to decrease that feeling of tightness or stiffness that we tend to feel in our upper body, especially after we're sitting for a long period of time. So sometimes when we're sitting for a long time, we tend to hunch forward, myself included. I always tell people to sit up nice and tall with good posture, but I'll be the first to admit that it's harder than it sounds. So sometimes when we hunch forward, we get this tightness within the front part of our body, within the chest, within the shoulders, and that in turn decreases our mobility within our thoracic spine, so that mid to upper back region. So maintaining mobility within this thoracic region, it's really important to help prevent or decrease any upper back or neck pain. And typically, like I mentioned, we tend to see that when we're sitting a lot all day, especially at a computer. So we're going to go through a few movements to stretch out the chest and increase the mobility within the spine. So I want to first introduce you guys to a simple exercise to start stretching out the chest. So let's bring Zach back on screen to help us demonstrate with some of those. All right. So Zach, the first exercise we're going to be going over, it's just kind of stretching out that chest. So I'll have you lay on the foam roller with the foam roller vertically down the length of your spine. And then go ahead and bend your knees up and have your hands resting on your chest or on your stomach. And then from here, yeah, you're already going through the motion. From here, I'll have you move your arms out to the side. Stay nice and relaxed. And Zach, you should be feeling a nice, comfortable stretch within that front part of the chest, kind of right below the shoulders as well. How's that feeling?
Pretty good.
All right. And so from this position, we're just going to let gravity do its work. All right. We're not straining any muscles. We're just nice and relaxed. Okay. And then from this position, we're going to make it a little bit more intense. All right. We're going to add a little extra movement to further open up and stretch out that upper body. So from here, Zach, what I'll have you do is raise your arms directly up towards your ears in a slow and controlled motion. Yeah, just like that. These are called snow angels. So Zach, one thing we want to touch on is to make sure that low back isn't arching up. There we go. We want to keep it nice and flat. That low back arching up is a form of compensation that we tend to use whenever we have any sort of decreased mobility in the upper back. All right. So now let's moving on. Now the chest is nice and stretched out. Let's increase some of that thoracic extension. So as I mentioned before, when we sit for long periods of time, we tend to round forward through the shoulders and through the thoracic spine. So for this activity, Zach, I'll have you laying on the floor still. And then with that foam roller, I have you turn it sideways. So it's just laying right underneath your shoulder blades. All right. And go ahead. And from here, I'll have you place your hands behind your head. There you go. And then just real gently leaning backwards. All right. This is a great movement to kind of help it open up and extend that thoracic spine. You may end up hearing a few pops, little pops here and there. That's totally normal. Sometimes expected. Sometimes those pops feel pretty good. That's
Victor,
just, yeah.
what if I can't put my hands behind my head because my shoulders are really tight?
Yeah, you can keep your arms crossed on your chest. Yeah, that's a good question, Zach.
Thank you.
All right. And then, so an easy way to kind of modify this, or if you're crunched for time and you're working at a computer for a while, when you're sitting in your chair, you can do this exact same activity. Yeah. So you'll place it the same spot, just below those shoulder blades. And then same movement, extending back, making sure we don't sit back in the chair, and then reaching back and holding that for a second or two, And again, in this position, if you're unable to get the arms up overhead, you can have them crossed along your chest, Zach. All right. How's that feeling in the chair?
Pretty great. Good relief.
All right.
I was sitting in a chair all day.
Perfect. Do you hear any pops in the back?
I did when I was on the ground.
Okay. Yeah. And like I said, that's normal. It's sometimes expected with this movement. All right. And so let's get into another activity to kind of help with that thoracic spine. So this next one's called thread the needle. And so this one's a fun one. And so Zach, I'll have you turn onto your hands and knees with the foam roller positioned parallel to your body, just like that. And so from this position, I'll have your right arm resting on that foam roller. All right. And from here, gently push it away, kind of rolling it away from you while rotating, keeping your head in line with your arm. There you go. Getting some nice rotation throughout that thoracic spine. And nice and gentle. All of these will be nice and slow and controlled throughout the Zach, how does that one feel?
I'm a little stiff. It feels good though.
All right. Yeah, so if you're feeling a little stiff, you can take a little extra time through any of these exercises, through any of these stretches. If you're feeling stiff, spend a little extra time, a few extra minutes on it. All right. So now that we're nice and stretched out, we're nice and loose.
Wait, Victor,
Before-
do you do both sides?
Oh, yeah. Good question, Zach. Yeah, so definitely both sides are important to cover. You want to do your right side, you want to do your left side. So nice and slow and controlled, reaching out as far as you can. And if for some reason you're having any sort of pain in this position, you don't have to roll out as far.
Hey, Zach, it looks like you could use some nice mid-back mobilizations over there, bud.
I could, yes.
Victor, why don't you help him out tomorrow in the office?
Yeah, definitely, Zach. We're going to have to set aside some time.
I'll hold you to that.
We've got to work on that. All right, so let's get into some strengthening exercises. All right, but before we do that, I want to have another poll just to hear from you guys at home and get a little feel on how everyone's doing. So next question, just asking if you've ever used a foam roller to help facilitate any sort of strengthening exercises. All right, and this can be in any way possible. Zach, have you ever used a foam roller to facilitate any strengthening?
I think so, yes. Sometimes.
I've seen you using it here in the clinic. All right. So good feedback from everyone. So let's look into a few exercises. All right. The first exercise we'll demonstrate is called the wall slide. So this exercise is great at targeting the muscles in the back that all connect to your shoulder blade. So to do so, we'll begin standing facing a wall. Go ahead and stagger your feet a little bit. And then from here, I'll give you a second. Yeah, and then from here, placing the hands on the foam roller, about chest height. And then slowly slide your hands up overhead. And once you get to the top, gently squeeze those shoulder blades together and then pull them back down. There you go. And when you get to the top, Zach, go ahead and pause up there, squeezing those shoulder blades together. You should really start to feel those muscles on your back really start pinching together. All right. And so to make this a little more challenging, we're just going to throw a TheraBand around the wrist. And so for those of you at home, if you have a TheraBand, more than welcome to throw those around the wrist. If not, no problem at all. So from here, Zach, with that TheraBand, I'll have you keep the arms shoulder width apart again and keep tension on that TheraBand the entire time. And trust me, you don't need a heavy band for this one. It'll be a burner, it'll work those shoulders and the shoulder blades pretty well. Zach, how do those feel?
Pretty tough. I'm also sweating, so.
It's a hard one. You got to turn on the AC in there.
Yeah.
Okay. So moving on, it's important that we get to work in our core. So this next one's a fun one. Our next exercise is called the dead bug. And some of you may have heard of it before. We're just going to spice it up a little bit and throw it on a foam roller. So same position as we had earlier with that foam roller down the middle of your back with the knees bent up and the feet flat on the floor. And so before we get into any movement, Zach, we're going to work on activating that transverse abdominis, what we call, is just a fancy term for the deep core muscles. All right. So to do this, I'll have you place your fingers on the front of your hips, those hip bones right up front, right in there. Yep. And then from there, move it up about an inch or so, just slightly up. All right. And once you're here, imagine that you're kind of squeezing into a tight pair of pants. All right. That you should feel the muscle underneath your fingers really kind of tense up a little bit. May not be much, but it should feel up a little bit. And then you should kind of feel your stomach sink in just a little. All right. So that's how we're going to activate those deep core muscles. And we're going to hold this activation throughout the entire exercise. So while maintaining that activation, I'll have you raise one arm directly above your head. And then bring it a little further up closer to your ear. There you go. Be sure to breathe the entire time. And now back down. There you go. All right, and now let's do the other arm as well. The entire time, maintaining that core activation. How are these, Zach? Challenging enough?
Challenging to keep your back flat, but I'm sure that's the most important part, right, Vic?
Absolutely. The back will be flat the entire time we're doing this exercise. All right, so let's make it a little bit harder now, Zach. So in this position, as you move one arm up towards your ear, I'll have you raise one leg just slightly off the ground, and it'll be the opposite leg. And if you need to, you can place that left arm on the ground or on your stomach. There you go. That'll make it a little bit easier. And then alternating. So it's important this entire time we're keeping the back flat on that foam roller and alternating which arms are using. And
I guess this is something else I need to work on in clinic tomorrow.
We're going to add it to the list tomorrow. We're going to run you through the ringer. All right. These a little challenging for you, Zach?
Yeah, it's tough.
All right. It's a tough one. So, Zach, I'll let you take over and kind of go through some of those lower body exercises.
What's up, guys? So oftentimes we avoid lower extremity strengthening because of the intensity and the difficulty of the exercises. A foam roller can be used to help facilitate the challenging movements that will strengthen lower extremity muscles, including your hamstrings, your quads, and your glutes. So let's begin with me and Vic's personal favorite, foam roller assisted RDLs. The RDL, or the Romanian deadlift, is an exercise used to develop the strength of the posterior chain muscles, your low back muscles, your gluteus maximus, the hamstring, everything on the back of your body. When done correctly, the RDL is an effective exercise that helps strengthen both the core and lower body with one simple move. It is difficult to initiate the movement, but the foam roller helps you with this. It helps facilitate. Vic, I see you putting your hand on the wall already.
It's a little challenging, Zach.
So begin in a standing upright position, resting the foam roller on the foot. Just like that. Push one leg off the ground with the foam roller and bend forward at your hips. You kind of want to tilt your hips forward, not just flex forward your entire back, lowering your chest towards the ground, just like Vic is doing. Then return to an upright position and repeat.
Hey, Zach, where should I be feeling this at?
You should feel it in the leg that is actually on the ground, in your left leg for this thing.
Okay.
Also feel it as a slight stretch in the front of the leg that you're pushing back. Do you feel that?
I feel that.
And back up. So all the strengthening is for the foot that's actually on the ground.
Okay.
Make sure you keep your back straight during the exercise and try not to let your knee move forward as you lower your weight. Very good. Moving on to wall squats. This is a simple exercise which builds quad strength. Sometimes when you perform the exercise without a foam roller, the wall adds some extra unnecessary friction. Victor, you want to give a demonstration without the foam roller?
That's tough.
So your shirt gets stuck. It's kind of uncomfortable.
Yeah.
Place the foam roller there. You'll easily be able to move up and down the wall and placed in an optimal position that activates those quads. So as you can see, Vic, turn your camera down a little bit. So he's beginning by standing with the foam roller between your back and the wall. Slowly bends his knees, bends his knees, and rolls down the wall into a squat position. Return to the starting position. What you want to do is make sure you're putting pressure on that foam roller, keeping it against the wall. That will help activate the quads even more. Don't let your knees bend forward past your toes, and don't arch your back. You got to keep your back flat, just like Vic talked about before. Just like that. How's this feel, Victor?
Yeah, my quads they're burning. They're working for sure.
Good thing we rolled them out before, right?
Absolutely.
There you go. All right, thanks for demonstrating that one. All right, so lastly, we'll be performing a series of bridging on the foam roller. Bridging is an excellent exercise for building hip strength and stability, in addition to activating that core like Victor talked about. For these exercises, the foam roller will add an additional challenge, which require increased hip and core stability. So begin by lying on your back, just like that, with your knees bent. Place the foam roller underneath your feet, just like that, and your arms on the floor beside you to add some extra support. We can change that and modify that as we go on. So what you're gonna do, you're gonna tighten your abs, that same movement, that TA brace that Victor talked about before, and then slowly activate your glutes and lift your hips off the ground into a bridge position, keeping your back straight. So unlike before, where the foam roller helped facilitate the movement, it helped like roll again up the wall, it helped push that leg back in the RDLs. This one actually makes the movement even more difficult because of that, trying to stabilize that foam roller, not letting it roll. But Victor, go again. If you hold briefly and you hold for a longer time, it'll be more intense. But the whole time, are you making sure that you keep your abs tight?
Oh, good call. I forgot about that.
There you go. Now, if you want to make it harder, which he's kind of doing because he's checking his abs, kind of keep those hands off the ground. Another way to increase the intensity of the exercise is by performing a single leg march that will require additional core stability. So Victor, what you're gonna do, you're gonna bring your hips up and then march with one leg off of the foam roller. Good, and back down, and then march with the other leg.
Do I stay up the entire time?
So we can do it both ways. So you can do it, first you can go up and just bring one leg up, place it back down, and then go back down. Or you can go back up, bring one leg up, and then the other, and then go back down, which is slightly a little more challenging.
Yeah, that's tough.
Victor, can you do like 10 sets of 10 for me on those?
Yeah,
I'm just kidding. I'm just messing with you. Great job, guys. So, we have a ton of questions pouring in. So we'd love to start to get to some of your questions so we can answer them. Just a reminder, any questions that we don't get to, Zach and Victor have happily agreed to answer them on the back end, and we can shoot you a note afterwards. And again, we'll have their emails up at the end of the webinar so you can reach out to them with any specific or personal questions you have. All right. fellas. Nice job. Really learned a lot today. So we had a few questions that came in about the type of foam roller that people should get. So Martha wanted to know about what length and diameter the foam roller should be. Should we consider half rollers? There were some other questions that came in about foam rollers having ridges versus not ridges, vibrating, what density of foam roller people should use. I know a lot of loaded questions, but I guess the purpose of the question, guys, is how do you choose the right foam roller for you? Victor, why don't we start with you?
Yeah, good question, Dave. So the perfect foam roller, it's going to be different for everyone. And so typically these round, smooth ones are a little less intense whenever we're doing any sort of exercise, like the soft tissue, kind of releasing muscular tension. So the smooth ones are going to be a little easier compared to the ones with the ridges. The ridges are really going to kind of dig in and apply a little bit more pressure. And then they also sell different firmness with the foam roller. So this one, as you can see, is pretty firm. There's some that are a little softer. And so it definitely works out to kind of play around with some, but I would suggest starting off with a smoother one just to kind of decrease some of that tension.
Zach, do you have anything to add to that?
Also, it can increase like the intensity too of like what surface is underneath the foam roller. So if you're like on a firm surface, you're just gonna sink right into the foam roller. It's just gonna be more intense. Also, if there's also the ridges on it, I don't know if anybody, obviously some of the people here have been to PT before. I'm sure you've done work with like a lacrosse ball and it's smaller. So that can be used for some of the soft tissue mobilizations that we talked about, but that's going to be firm and be specific to one spot. So it's just really what you're looking for. If you're looking at like just to release like one certain tension point, you probably want a smaller foam roller, but if you want to do all these exercises, maybe a bigger. But I understand the size of your New York City apartment, whether or not you can fit a big foam roller. So you can always use a smaller one and just do like single arms or single leg.
Yeah, Zach, not everybody has a washer and dryer in their New York like you do.
There we go.
Had to zing him for that a little bit. So we have a couple questions on type of foam roller, and then we'll move on a little bit, a couple more. So we have one question from Anthony and another question that I'm going to combine. So Anthony wants to know, what exercises can we do with foam rollers that have ridges? And then another ridge foam roller question I have over up in here, but I want to make sure that I got to. And I lost it. Give me 1 sec, fellas. If your roller has ridges, Jan wants to know, should you that position without rolling?
All right.
Why don't you start with that one?
So good question. So yeah, you could, the snow angels that he talked about, you can definitely do. It's just going to intensify the effect. Also, the ones we did at the end, the bridges, it might actually add some more stability, and it won't actually be as difficult as the ones with the smooth ones. I wouldn't advise rolling up the wall with the ridged one, or rolling with the squats with the ridged one. But you can still try it, and it would incorporate 2 into 1 as a strengthening exercise while also mobilizing your back. So there's pros and cons to both ways. Victor, anything to add?
Yeah, no, I think you definitely you nailed it with that. The ones with the ridges, kind of how Zach mentioned with the squats and the wall slides. The ridges aren't going to slide as well. It's not going to roll as smoothly over the wall. And then Dave, you had mentioned other exercises to perform with them.
Yeah, with a foam roller with ridges specifically.
With a foam roller with ridges. Yeah. And so kind of going over that again, you can kind of do, so in that bridge position, Zach, if you kind of want to demonstrate like a hamstring curl from that bridge position. And so again, with the ridges, it should work out, but it may add a little bit of friction. So in that position, Zach, what I'll have you do, going up in a bridge and then just pulling the feet backwards. That's really going to fire those hamstrings, the back of the legs, the back of the thigh, those muscles. And
Victor, I'm so happy that you mentioned hamstrings, because we have 2 questions about hamstrings right in the chat. So an anonymous attendee wants to know, can the foam roller be used to relieve tightness in the hamstring? And we have a question from Lori as well. She wants to know, can you kind of roll underneath that knee, or should you avoid that?
Yeah. So the foam roller definitely can relieve some of that tightness in the hamstrings. So kind of how we had demonstrated with the quads, laying on the quads, finding a sensitive area or a tender point and holding that for a little bit until that tension starts to decrease a little bit. You can do that same movement and that same concept with the hamstrings. And then the same with the knee. If you have any kind of tenderness on the back of the knee, you can use the foam roller, applying sustained pressure to the back of the knee. And now what I would say with that is if that pain is really jumping up in the back of your knee, then maybe take it a little bit easier, not put as much weight through your leg or onto that foam roller. And that's kind of how I guide everything with the foam roller whenever we're applying any sort of sustained pressure is, don't start off putting a ton of weight or a ton of pressure, just very easily kind of build into it.
Thanks so much, Victor. I totally agree. All right, guys, we have a Mythbusters question here for you. Steve heard you shouldn't foam roll your lower back. Zach, what do you think about that? Let's bust that myth, right?
Yeah, I mean, you could definitely foam roll your lower back, just kind of like what we said. I don't know if you should roll back and forth on your back all the time. So your spine is aligned in a certain way that there's a curve at the lower point that kind of what we were talking about, like flattening that curve. If you want to stretch out some of the parts of your spine, you can lay on the foam roller like he showed, like the thoracic part of the spine, which is part of your back, and do that extension just to open it up. But you want to keep it at one spot and do it, not just roll it back and forth.
Yeah, awesome. All right, fellas, we have a couple questions on the infamous IT band. So let's revisit those. So we have a first one for the IT band. Do you put pressures on key places? And ideal. And then we have another question that kind of ties in with that. Susan Surgeon recommended an IT band with foam roller for the knee. Do you guys know what he's talking about?
And again, I need the second one again. I can answer the first one. What was the second one?
The second one was a patient was prescribed a foam roller for the IT band. Do you know what the doctor was talking about for the patient?
He was released to release this IT band.
There you go.
Yeah. So no, the thing with the IT band is that it just naturally gets very tight because there's muscles that attach to both sides of it. And up specifically by the hip, there's your glutes that attach on one side, and then there's your anterior hip muscles like your TFL or your hip flexors that attach on the other side. And certain times people have dysfunction and one muscle activates more than the other. Just kind of natural. Your glutes kind of fire more often than your anterior hip muscles. Either way, it kind of pulls on that IT band. And at that spot at your hip, those parts become very tense because of that dysfunction in your muscles. Another point, though, about it that you want to watch out about your IT band is that you don't want to roll it over your hip bone or over your knee bone. Try to stay away. That part leading right up to it is probably going to be the most tense part. So you can leave it right there, but I wouldn't roll it on top of the bone.
It's great, Zach. Thanks. We'll go to Victor next. Victor, Jim wants to know what stretches using the foam roller are good for stretching mobility for the low back, lumbar, spine area. What would you recommend as like your top exercises using the foam roller for that area?
Exercises, yeah. So I really love that thread the needle exercise that we went over. I know we were kind of talking about that.
Hey, Zach, do you mind just demonstrating it again while Victor talks about it?
I got to get some work in on there.
Yeah, you do.
Yeah. And so this exercise, I know we were talking, was more so focused at the thoracic spine, but the spine, how it works, the lumbar spine, that low back, is affected by the thoracic spine, and the thoracic spine is affected by the lumbar spine. So targeting areas above and below will help improve mobility in that lumbar spine or the thoracic spine. And then also in this position, that relative rotation and that twisting motion that Zach is going through is going to get a nice little stretch going throughout that low back area. So
do I hold my breath when I'm doing this?
Not a chance, Zach. We're always breathing. You need to breathe with all of these exercises.
Thank you.
Yeah. And so, yeah, that's my go-to one. I love this one for both the middle of the back, that thoracic, and that lumbar region.
Yeah, Victor, it looks like Zach's getting his more range of motion as he does more of them too. So that's great.
Look at that. We're getting there.
Let's kind of talk about while Zach's doing this, Victor. If you were Zach's physical therapist, Andrea kind of wants to know how many reps would you recommend Zach doing of this, and how often a week would you recommend Zach doing this exercise?
Yeah. So with this sort of exercise, mobility, I love to get the mobility in as often as we can. So typically I'll tell someone to do that anywhere from 20 to 30 times within our session. And, it kind of varies with everyone. It always depends. And so if someone gets through 25, 30, 35, and they're still feeling a little stiff, throw in an extra 5 or so until you feel a little loosened out. And then, this is a good exercise to do daily. As soon as you wake up, first thing out of bed, get a little bit of mobility in, get that motion going. And then even before bed, nice little stretch to get in before you go to sleep. And so I'd recommend at least once a day, just kind of getting that mobility in throughout the spine. It'll help out and work wonders.
That's great. Thanks, Victor. And thanks for the demo, Zach. I'm sure you're feeling much looser now. I see your posture even getting better.
There we go.
We have a couple questions on the psoas, so I'm going to combine both. So what suggestions do you gentlemen have for stretching the psoas with the foam roller? And then we have another question. Are there any foam roller techniques that can ease pain in the QL and psoas? So kind of similar questions combined. You guys take it away.
So QL, definitely a smaller foam roller will come in handy here actually, but you would do it as place it in position of like the wall slides that we showed, and just place it on your QL and just kind of pressure into that area. Just kind of like we talked about, your QL is kind of located on the lateral side of your back, your low back, kind of just like right here. So you want to pressure into that. I would use the wall or the floor, but the wall is just as easy if you don't want to get down on the floor.
Zach, how about I demonstrate really quick for
Yeah, sure.
So in this area?
Absolutely. One thing you can do like an active release. You can go turn back into that area, turn away, and then go into it. Very good. The psoas is pretty tough, though. That was a good question whoever asked. Yeah, the hip flexors is a tough one to get with the foam roller, but you would be in the same position as the quads. You kind of would just focus on that outside portion of your hips. I would stretch that more, do a stretch, but like a foam roll, you can definitely foam roll that area. But it's kind of tough to get just because it's pretty local and right by your hip.
Yeah, Zach, when you're demonstrating that RDL with Victor before, you are going to get a little bit of a hip flexor stretch as well while you're working and strengthening the other leg. So there's
exactly, yeah, exactly. That's why we love that exercise, me and Victor.
Oh, yeah, you can do a billion things with that foam roll. Right? All right. So we're going into some precautions and maybe some things that patients are a little fearful of. So we have a question. What exercise positions are dangerous using a foam roller for older spines, potentially with compression fractures, things like that? What are those exercises would you avoid with the foam roller?
Yeah. Sorry, were you talking, Zach?
No, you're good, Vic.
Okay, yeah. So with any sort of compression fracture, we want to tend to avoid any sort of excessive forward flexion. So I'm trying to think which any of those exercises, Zach, do you feel that had a lot of that forward flexion?
Well, I think maybe even, the extension one that we did is extension, but when you come back up, you could dangerously put into flexion position. I also wouldn't just do anything really on the ground, try to do it more simple, like in a chair or on the floor, and use like a less firm foam roller. You don't want to really endanger the fragile spine in the sense of like using a firm foam roller against the floor and really leaning into it.
Yeah.
And as always, if you have any questions about if you should or shouldn't, consult your physical therapist or your doctor. They'll be able to provide specific instructions for your exact needs and be able to assess you as an individual rather than putting you in a bucket.
And so really quickly, all these exercises that we went over can easily be done against a wall. So instead of laying down on the ground, you can just take that exact same motion and put it against the wall. So that thread the needle that Zach was doing, could be hard to do on the ground, and you can just do it standing up against the wall. Same with the extension exercises, and then the one stretching out the chest when we were kind of reaching back. All of those can be done against the wall, so we don't have to be laying down on the floor and kind of getting in those funny positions.
Sure. We had a question about another like kind of precaution, perhaps. We have a question. What if your foam roller is shorter? Would you still recommend doing the deadlift that way?
That would be pretty tough. But you can, I don't, that would be pretty tough, but you could just practice maybe sliding your foot on the ground to start without a foam roller. That if it's a tough exercise to do like without the foam roller, and maybe go from there. If you don't want to lean forward too much, because purpose of that exercise is to keep that back kind of in a little bit of extension and not flex forward too much. So if it's too short of a foam roller that you can't comfortably place your hand and foot over it, I would try to stay away from that.
Sure. Yeah, just another suggestion. If you have little kids, if you have a wiffle ball bat, that works great. If you have a broom handle, that can work as well as a substitute for the foam roller and that mop handle, that type of stuff. Swiffer for you New Yorkers.
Absolutely.
Good call.
Every once in a while, I get a good idea, fellas. All right. We have time for a few more questions. I like this one because it's a demonstration. How close should your feet be to the wall when doing the wall slide?
Vic, you demonstrated that, and I talked you through it. So you want to show where the foot
The wall slide or the wall squat?
This one says the wall slide. I think perhaps it was the wall squat. So let's go with the wall squat.
The wall squat. We can do them both. Just
Why don't you do both? That's a good idea.
Cover all bases. Yeah. Zach, were you saying you wanted me to talk?
I got it. So yeah, you can walk me through this. Oh wait, I don't even know if you're going to be able to see my feet.
Here. How that works.
But yeah, so if you do it, you want to place your feet, first of all, shoulder width apart. And then, yeah, Vic, you better off you showing this probably.
Yeah, I'll show it.
Yeah. You want your feet shoulder width apart, probably at like a 90, where you can get to a 90-degree angle. Yeah, just like that. Not too far away from the wall. You want to be able to put pressure on the foam roller against the wall. And you don't really want your feet to slip out in front of you. Just position just like that. I would say about like 1.5 feet away from the wall.
Yeah, I'm about 1.5 feet away from the wall back here.
We're right on the same page, I guess. Yeah, 1.5 feet. But yeah, not too far. You don't want your butt slipping in front of you, and not too close to the wall, because we discussed this earlier. You don't want those knees falling in front of your toes.
All right. Thanks, guys. So we have another question. When is the best time to foam roll? Is it before exercise? Is it in between exercises? Is it after exercises? When do you guys recommend is the best time to foam roll?
I would say there's no correct way or when. You can do it all the time, but like doing it after exercise is really good, but also doing it before. We tend to sit all day, especially during now with everything going on. So you're in positions, you're stuck in a certain position all day, every day. And I'm currently stuck in that position right now. And you're forward. So the foam roller, what it's good for is to take you out of those positions. So I say if you're going to work out like after work, I would do some foam roller work right before, just to loosen up and put you in different positions. And then you can get into your exercise.
All right, yeah. And we have time for one last question. I know there's a ton more questions in the Q&A, and we appreciate them. We will get back to you with the answers to all those questions in the Q&A if we weren't able to get to them during. So the last question, kind of going off that, should I foam roll every day? If so, how many times a day? Is that safe?
It's safe. If you want to foam roll every day, be my guest. If it feels good for you. But again, if it's painful and it's something that you don't find comfortable doing every day, then don't do it every day. Take a break, because sometimes your muscles can be sore from the exercises that you're doing. Sometimes soreness takes 2 days. So if you're very sore, I wouldn't do it every day. But if it's really starting to open you up and you're seeing the therapeutic effects, I would do it as often as you can. Vic?
Yeah, definitely. I think you hit it right with that. You know, I usually tell people it kind of as tolerated. So If you want to go a few times a day, absolutely. If you do it a few times a day and you're sore the next day, then maybe kind of back it off a little bit. If you go twice one day and you're sore the next day, back it off to once a day and just kind of see how you respond with that. Always kind of seeing how you feel, being able to observe any sort of changes in that soreness. And again, anytime of soreness, we typically like to, stay up and active. I usually tell people, go out for a walk or so, do some of these mobility exercises just to kind of help with that soreness.
All right. Thanks so much, guys. We really appreciate it. There will be a handout going out with these exercises that they demonstrated. And again, we'll be demonstrating those exercises and answering those questions for you. So we hope today's talk was valuable. You learned a few more ways to use your foam roller during home workouts. If we didn't get to your question, we'll do our best to reach out to you directly after. So thanks so much to Zach and Victor. If you'd like to reach out to Zach and Victor, we have their contact information up on this slide. You have Zach's email and Victor's email. They can do a personalized assessment for you and answer your individual specific questions in the clinic. They're both at our Chelsea office, as I mentioned. And on the next slide, you'll see mine and Michelle's contact information. If you'd like to schedule an appointment at our Chelsea office, you can reach out to either one of us. Lastly, at Spear, we treat an array of conditions from head to toe. There's something that we're really proud of. A couple of weeks ago, we were selected for the second time in a row as the nation's top physical therapy outpatient practice. We're extremely proud of that. We're extremely proud to continue to serve New York City, Queens, Brooklyn, and Westchester. So should you feel that you would benefit from some individualized guidance and treatment, please don't hesitate to reach out to any one of us individually. We'll personally coordinate your care and help set you up with one of our members of our team for an evaluation. Thanks so much for spending time with us today. We hope you enjoyed the webinar. Be well.
Thanks, everyone.
Guys, thanks for coming. Thanks for the questions too. They're great.